Good afternoon, everyone. My name is Jaime Aponte, and I'm here to present to you Brazen, Brain Injury Diagnostics. So, we all love sports, right? We love American football, we love contact sports. But what we don't love is getting hurt playing sports. And currently, there's a big problem with hand injury and traumatic brain injury, which can lead to very harsh disease while playing these sports and getting repetitive impacts. So, currently, there's a big problem, and it's that when you're assessing injury on the field, it's a very subjective way to do it. You do tests on the field to the players, you ask them how they feel, how they are. However, this can only assess really very big trauma, but it cannot really detect asymptomatic traumatic brain injury. However, we are bringing to you a quantifiable assessment of the brain injury, which can be used on the field and which can be used very easily. And that is why we bring to you Brazen Diagnostics, a bold, honest approach to brain trauma. So how does this work? We're going to use a medical device which will measure multiple variables which have been backed up by the medical literature from Mayo Clinic at Jacksonville, Florida, and other research as well. And we will look at eye movement. Why? It is shown that changes in eye movement immediately after getting hit in the head can display asymptomatic brain injury. This way you can assist the player on the field, take them off the game, and do further workup if it's necessary. So right now, the product landscape, we're bringing something new, something novel. Why? Because what's out there right now is either very complicated to use and not really user-friendly, for example, in the military, or there are other applications that are not really too accurate in terms of detecting the potential brain injury. And our go-to markets would be high school athletics. Why high school athletics? Well, there's a big amount of players all around the United States. Here in Minnesota, we're thinking about the Minnesota High School Association, the Coaches Association, to go there and present them this product to start off and to make the game safer for our athletes and to start off a business and sell this to the teams as well. So we have we have leaders on the field, leaders composed of neurologists from Mayo Clinic Rochester, Mayo Clinic at Jacksonville as well. We have people with expertise in consulting, informatics as well, and we have really good personnel developing this project right now. So to finalize, Brazen Diagnostics, a bold, honest approach to brain trauma. Thank you very much, and let me know if you have any questions.
So I've got a question here. How do you validate your technology, and can you protect it by IP?
So right now we're in the process of doing the research to develop this technology. It's been done mostly at Jacksonville. So we're right now collecting patients and working also with engineers to start to further develop the algorithm, and that's where we're at right now to validate this technology.
So is your expectation that this product would involve baseline scans for all of the players on the field so that you know what their normal responses are?
Yes.
Okay.
Right now, that's what we're expecting to do.
Do you have an expectation of the time it takes for, I'm assuming as the trainer is going to utilize that, put it on, look at the baseline, how quick can you evaluate, or the expectation of evaluating a player that quick?
It should be like less than 5 minutes. It's a very quick assessment because it just when you use the device, you put it right in there in front of the player, it'll look at some particular movements and it will be fairly quick. So it also allows for the flow of the game and all of that as well.
Is it a specific standalone device, or is it an app that you would put on a normal phone or device or other technology?
We're thinking about developing a device for now. However, it will be a very small device, portable, so that can be easy to use on the field.
So how does the device compare to the military one, besides the size?
Compared to the what?
Well, you mentioned that there's a military in terms of something that could be comparable, but it's too cumbersome to use. So how does yours differentiate?
What we've researched so far, the current military products that are available require a certain level of expertise and training to be used, to be able to use them. However, this is very user-friendly. As you saw in the previous slide, it has so what we will do is that you open the device, you put it on, and it has some specific signs so the player can look at them, and it can detect the variations in these variables. And then if one variable you're like really off the expected values, then we assess, okay, potential risk, take the player off the field, work them up.
Have you thought about the risk of misdiagnosis if something had happened and someone...
So we're really not trying to be a final diagnostic product. It's more of prevention of further injury. So we really don't see ourselves, as marketing as, we're going to diagnose brain injury and this could be, life-threatening. It's more of like raising awareness. This player might be hurt. Let's check them out.
So the key utility then is allowing the coaching staff on the sideline whether to return a person to the game or not.
Exactly. Yes.
Could it be used for recuperative period afterwards? See at some point when they return back to their baseline?
Definitely it could be used because if, let's say you had brain injury and right now you have, right now you're being sacked or whatever, the movements have changed. However, what we expect is that if you have a player that is out of the normal boundaries, we take him off the game, they should be further assessed maybe by medical experts. We don't, right now, that's what we expect.
Is get false signals out of something that's not brain injury? For instance, if somebody's been drinking or some other drug?
Well, we haven't really assessed the potential use of drugs because right now, where we expect to use this is on the field with athletes, where we really don't expect that much to be happening. The product will be fixed so that there's no confounding with movements and external, variables that could affect like lightning and all of that. So that's what we have really looked at right now.
Thank you.